Thanks, everyone. Nice to be here. My name's Nally. My role at Windana is the Chief Impact Officer, and I use the pronouns she, her. And I've got Brooke Paisley with me here today, which is has the role of Business Development and Impact Manager at Windana. So some of you might think of Windana as an AOD organisation, and we certainly are that, but we also deliver a whole breadth of services across Victoria. So we provide a whole bunch of wraparound services, including holistic care, support and treatment, and, for example, provide services to First Nations communities and family services, mental health, education, family violence in residential and community settings. So we recognise that for us to provide authentically responsive services to clients and carers and supporters and communities, that partnerships are crucial. We know that when we partner we can have greater impact, and we can pool our resources, we can expand our reach, we can upskill and build our workforce capability and leverage each other's expertise, or we can if it's done really differently, because I don't think we're doing it right now.
So when I was a kid, my sister had something truly rare, a black-haired Barbie.
You liked it?
Back then, most Barbies were blonde, so this was like the unicorn of dolls. And needless to say, my sister wasn't good at sharing. Every time we played, it turned into a negotiation. I'd make my case. If you let me play with the Barbie, I'll give you one of my Care Bears. She'd counter. You can have the black-haired Barbie, but only if I get the bedtime Care Bear Barbie overnight. Care Bear thing overnight. Sorry about that. Got very excited about my Care Bears. And when talks broke down, Mum and Dad stepped in as the ultimate arbiters of justice. They didn't want tears, or worse, a Barbie custody battle. So they created rules, time limits, supervision, and sometimes Barbie went into neutral territory on top of the fridge until we cooled down. Now, why am I telling you this, other than to really point out that I'm a middle child and clearly neglected? Because partnerships in our sector often feel a lot like these Barbie negotiations. We talk about collaboration as if it's effortless. Everyone shares, everybody wins. That's the rhetoric. But the reality? There's usually rare resources, funding, workforce capacity, influence, and everybody wants a piece. Power imbalances creep in. Some partners hold the Barbie and others just get the Care Bear, or things. And when tensions rise, we need governance, our version of Mum and Dad, to mediate and keep things fair. Integration isn't about good intentions. It's about designing for reality. Scarce resources, power dynamics, and structures that make sharing possible. Without that, partnerships slip from collaboration to a standoff over who gets the black-haired Barbie. Fairness needs to be more than hope, or Barbie stays on top of the fridge.
Okay.
So I've had the privilege of working in a variety of roles whilst navigating the identification and establishment, and also the maintenance and sometimes the renegotiation of a variety of partnerships. And my reflections, and this is probably no surprise to any of you here, I'm sure, is that partnerships are shaped by power. Who holds it? Who uses it? Who's left navigating it? And who's even aware of it? In consortiums, power's often unequally distributed. Larger organisations are assumed to lead. Smaller intersectional organisations are invited in, but not always empowered. Representation varies, a CEO from one org, a program manager from another. This imbalance affects the sense of influence and immediacy of decision making. We've seen power used well, and we've seen it mismanaged. Sometimes unintentionally, sometimes structurally, The result is that subservient relationships start to exist instead of equitable ones. Decisions are made without transparency or shared agency. Integration replicates hierarchy, not collaboration. And what we propose is that there's equity in representation, so match the roles across the organisation, that there's shared decision making, so build governance that reflects all voices, and that there's transparency in development. So co-create from the start, not just consult. We've learnt the impact of inviting voices into a conversation or project 3/4 of the way through, and we know how that can alienate and minimise our input.
So we talk about integration, but we're rarely funded to provide it. Partnerships require time, trust and infrastructure, but these are rarely resourced. Organisations are expected to partner while managing multiple governance committees, reporting lines and service demands. Greater funding often flows to the lead agency, which reinforces hierarchies and limits shared ownership. The assumption is that often larger organisations will lead, and it's flawed. It doesn't reflect community need, cultural alignment, or the unique expertise smaller organisations can bring. Leadership should be based on capability and context, not size. When funding models default to larger agencies, it creates structural inequities. Larger organisations benefit from economies of scale and established infrastructure, while smaller organisations are left under-resourced and they're often closer to the community and more agile. This imbalance limits innovation and diversity in service delivery, and it risks marginalising voices that are critical for authentic integration. True partnership means recognising that leadership can and should be shared, rotated or distributed based on strengths and not hierarchy. So how can we do it differently? Well, fund the partnership itself. Allocate resources for coordination, conflict resolution and shared learning. Funders can diversify financial risk. Support models where multiple organisations share funding and accountability. We can also build capability across all partners, not just the lead agency. Everyone needs support to contribute meaningfully. Didn't change slides. One second. So partnerships are not static, they evolve, but we rarely evolve with them. Integrated care relies on partnerships that span sectors, disciplines and communities. And while partnerships change over time, our approach to managing them often remains fixed. This creates gaps in governance, resourcing and trust. Many partnerships begin with a CEO to CEO handshake and a shared vision. That vision is then handed to operational teams, often without resourcing, guidance or clarity. Also, the initial vision can become a dim memory as the reality of running a service kicks in. Initial decisions are often made by consensus, but sustaining that requires intentional effort. As partnerships mature, power shifts, priorities change and conflict emerges, but we're not trained to manage this. Funders expect partnerships to be seamless, but they're relational, not transactional, and conflict is healthy and normal if managed well. So what do we need to do? Resource for the full life cycle. Funding and support should extend beyond the establishment to include adaptation and renewal. We can also build skills in partnership management. Training in conflict resolution, shared governance and evaluation should be embedded in leadership development. We should also have the courage to evaluate the composition of partnerships. Regularly ask who's at the table and who's missing. Equity and inclusion must be intentional and based on consumer, carer and community need. I've already changed slides for you.
Just one step ahead as usual. Thank you. So I'm going to talk about an example of a partnership that, excuse me, that lacked strategic rigour. and was pursued with potentially limited benefit. So this was a meeting that I held in discussion with a consortium approach to do a tender submission. And I discovered in that very first meeting that the following decisions had already been predetermined. The lead agency, the service model, the staffing discipline, the FTE allocations, the budget allocations, the service locations, the language used to describe the partnership, the governance, and the expertise that we were bringing. The underpinning practice framework was already decided, and the timelines for review for the submission had already been decided. So not much left for us to contribute. And then after the submission date, so the submission date had closed, I had to ask whether it had actually even been submitted. Can we have a copy of it? What budget was submitted? And what's the service implementation plan, and what's our role in that? So the unintentional message from that way of operating is that we were unheard, possibly misrepresented, excluded, and placed in that subservient position and left trying to navigate that maze, but navigating it alone. That's an example of power over, not power with. And it's an example of inauthentic engagement and that transactional relationship that Brooke referenced earlier, lacking in generosity and not enabling genuine agency, and probably not aligned to the organisation's values, let's face it. I know I've been guilty of this style of operating in the past too, and I do understand the time and resource pressures, but it's not a style of working that we would support with consumers and carers. And we've got an obligation to role model healthier ways of working if we're to truly break new ground and to be reformational and work in the ways that are different.
I can take that.
If we want integrated care and we're truly responsible for reform, we need integrated partnerships. And that means reducing that tension between the rhetoric and the reality, shifting from transactional funding relationships to genuine collaboration. We know that true, mature partnerships can be read in the responses by the funders. They can see it, they can read it, they know it. Generosity results in being able to cherry pick all of the gold that each partner brings and makes the bids more impressive, cohesive, and translates to that operational staff team who need to implement the services in the end. We also need to include lived experience and equal representation in every room, in every meeting. We accept that we are imperfect partners, but we're prepared to commit anyway. We also need to approach the partnerships with humility. In fact, I think Tom used that word earlier today. Approach it with humility, not hierarchy, and to build the trustworthiness and credibility. We've said this a couple of times today, I think, but we really do need to invest in this unfunded work. And I'm sort of saying that with a little bit of a smirk in some ways, but the relationship building is critical. And we know that tender timeframes are hideous, so attention to the relationships needs months, if not years, of work in the background. So we also need to be aware of sitting with the discomfort of the ugly teenage years. Perhaps fighting over the Barbie was a little earlier than the teenage years, but we do need to sit with the discomfort of those ugly teenage years of the partnership as it matures, rather than rushing in to polish that for submission times. More than anything, sort of stating the obvious really, but keeping the community at the centre of the vision. And setting up the foundations to be solid so it can translate to those operating teams who are trying so desperately to implement something new, something fresh, something innovative. So Windana is ready to do this differently. We're not perfect partners, but we are committed to doing it differently and doing it better. So right now, we've all got this window of opportunity. We know that there's limited new funding options coming our way in the next wee while. And so it means that in some ways we've got the time and the capacity to invest in our relationships. Now's the moment to do that unfunded work, to build that trust, clarify our roles, and lay the solid foundations that true partnerships require. Thanks very much.
G'day everyone, I'm Pete Warden. I'm the Director for Mental Health Hubs at Neami National, the new use he, him pronouns. Thanks very much, Di and Brooke. I think that was really enlightening, and obviously I feel that there's some pretty deep responsibilities for me too, being a director of services which are commonly delivered in partnership. And I think the thing that jumps out for me is Neami often talks about parallel processes, and that the ways that we engage with the people at the service level should be the ways that our managers engage with staff, and should be the way that we engage with our partners. And I think we often put a lot of thought into how are we thinking through the power differentials between a peer worker and a clinician, how are we setting up our governance structures, how are we responding to a request from chief psychiatrist or our incident management processes. But I don't know that we put the same level of consideration into those power imbalances within a partnership. And it really also made me think about how do we step up and step alongside our AOD colleagues in this space. So if I think about one of those power differentials, it's surely that there's election money in supporting people in distress, but there's often far less money in supporting people dealing with drug and alcohol issues due to the stigma in our community. So coming right in off the bat, there's such a deep power imbalance between those two things. So I think I'll walk away from this, thinking about how we screw up those partnerships a bit less and are more collaborative in our governance structures, but also how do we be a good ally to our drug and alcohol colleagues and support them in the kinds of reforms that they're trying to deliver as well. So thanks very much, got a lot out of it. Cheers.
Thank you.